But here's what most people don't realize. Are you waking up tired, losing confidence, and quietly wondering why your body doesn't respond the way it used to, even though you still feel young inside and want that spark back? I'm Dr. Rachel Ross, a board-certified urologist, and I've spent decades helping men in their 50s, 60s, and 70s reclaim strength, energy, and intimacy. There's a forgotten reflex point most doctors overlook that can change everything. Tell me where you're watching from, and don't forget to like and subscribe. But here's what most people don't realize. The reason your potency seems to fade after 50 has almost nothing to do with getting old, even though that's what you've probably been told over and over again. I hear it every day in my clinic. Men come in with their shoulders slumped, eyes tired, voices low, and they say, "Doc, I guess this is just what happens when you get older." And I have to gently stop them right there. Because that belief is doing more damage than their bodies ever did. Aging changes many things, yes, but it does not automatically shut down your ability to feel desire, get aroused, or have a strong, satisfying erection. What really changes is how well your nerves talk to your blood vessels and how freely blood is allowed to flow where it needs to go. An erection is not some mysterious magic trick. It is a very real, very physical process. Your brain sends a signal. That signal travels down your spinal cord through a network of delicate nerves and into the pelvis. Those nerves release nitric oxide, a natural chemical that tells the blood vessels in your penis to relax and open wide. When those vessels open, blood rushes in. The tissues expand and firmness appears. When everything is working, it happens almost without you thinking about it. But over time, stress, inflammation, sitting too much, and subtle nerve compression begin to dull those signals. The message from your brain gets weaker. The release of nitric oxide drops and blood flow becomes sluggish. The desire may still be there, but the body can't quite follow through. This is why so many men are confused. You might still feel attracted to your partner, you might still want intimacy, but your body responds slowly or not at all. And that disconnect is heartbreaking. I've seen men grow quiet and withdrawn because they feel like they're letting their partner down. They stop initiating touch. They avoid situations that might lead to intimacy. And all of that emotional distance grows out of a physical problem that was never properly explained to them. 2, most of the time they're handed a pill. And pills can help some men, but here's the truth. No one says out loud. Those medications only work if the nerve signal is already strong enough to tell your blood vessels to open. The pill doesn't create desire. Why potency declines? It doesn't fix damaged nerve pathways. It simply amplifies a signal that's already there. So, if your nerves are sluggish or compressed, the pill has very little to work with. That's why some men try one dose after another, feeling hopeful at first and then deeply disappointed when nothing really changes. They think their body is broken, when in reality, the wiring just isn't firing the way it used to. And then there's testosterone. Yes, hormones matter. They affect desire, mood, and energy. But testosterone alone does not create an erection. I've treated men with perfectly normal testosterone levels who still struggled with firmness because their blood flow and nerve response were compromised. And I've seen men with slightly low testosterone still enjoy strong function because their circulation and pelvic nerves were healthy. Potency is mechanical and neurological before it is hormonal. It's about pressure, signals, and flow. What makes this especially painful is how silent most men stay about it. You don't talk about it with friends. You don't always even talk about it with your doctor. You just carry that quiet frustration inside, telling yourself you should be grateful for everything else in your life while feeling this one deeply personal loss. But intimacy is not a small thing. It's how many men feel connected, confident, and alive. When it fades, it takes a piece of you with it. I want you to hear this clearly. Your body is not betraying you. It is responding to years of wear and tear on tiny nerves and blood vessels that no one ever taught you how to care for. Once you understand that, something shifts. You stop blaming yourself, you stop feeling ashamed, and you start to realize that there may be a way to wake those systems back up. And this brings us to a small hidden control point in your body that almost no doctor ever teaches men to use. But here's what most people don't realize. Hidden just beneath the surface of your body is a small pressure-sensitive zone that acts almost like a light switch for male blood flow and arousal. Yet most men go their entire lives never even knowing it exists. In simple terms, it sits in the soft area between your testicles and your anus, a place doctors call the perineum. But what I want you to think of is the pelvic control center. This is where some of the most important nerves for erections, prostate function, and bladder control all pass through. When this area is healthy and responsive, signals travel cleanly from your brain to your pelvis. When it is tight, inflamed, or compressed, those signals get muffled like a radio with too much static. Inside this small region lives a web of nerves that directly connect to the prostate and the erectile tissues of the penis. These nerves don't just carry sensation, they control blood vessel opening, muscle relaxation, and the release of nitric oxide. That means when this spot is gently activated, it sends a message to your body that it is safe to relax, open up, and allow blood to flow. This is why some men feel warmth, fullness, or even a subtle pulse when this area is stimulated. It's not imagination, it's the nervous system waking up. What fascinates me as a physician is that this is not new knowledge. Ancient healing systems in China, India, and even parts of the Middle East recognize this area as a center of male vitality. They didn't have the language of nitric oxide or pelvic nerves, but they understood that pressing and massaging this region could restore energy, improve urination, and strengthen sexual function. Over time, as modern medicine focused more on drugs and surgeries, this simple body-based wisdom was quietly forgotten. Men were taught to ignore their pelvis unless something went terribly wrong. Now, let's talk about what happens to this potency switch as you age. Think about how much time you spend sitting in the car, on the couch, at the computer. That constant pressure presses directly on the perineum and pelvic floor, slowly reducing blood flow and irritating the nerves that run through it. Add stress, the hidden control point to that which causes muscles to tighten and hold tension, and you have a perfect storm. The pelvic floor becomes clenched and undersupplied with oxygen. The nerves become less sensitive. The blood vessels become less responsive. Over years, this can quietly turn down your body's ability to respond to arousal, even if your mind is still interested. This is why I see men with no obvious disease, no major injury, and no severe hormone deficiency, still struggling with erections. The control switch is simply stuck in the off position. Not broken, not gone, just dormant. And the beautiful thing about nerves and blood vessels is that when you start stimulating them again, they remember what to do. So where exactly is this spot? When you are sitting or lying down, place your hand gently behind your scrotum in the soft area before you reach the anus. That's it. You don't need to go inside your body. You don't need any special device. You're simply making contact with the gateway where your pelvic nerves and blood vessels gather. Biologically, when you apply gentle, steady pressure here, you are activating nerve endings that communicate directly with the prostate and erectile tissue. That activation increases local blood flow, reduces muscular tension, and helps restore the nerve signal that tells your penis to fill and become firm. This is not about force. It's about awakening. Many men are surprised by how subtle it feels at first. A mild pressure, a gentle warmth, a sense of relaxation spreading through the pelvis. That's your nervous system responding often for the first time in years. And when that happens, something begins to shift, not just physically, but emotionally. You start to feel more present in your body, more connected to that part of yourself you thought was fading away. But touching the spot isn't enough. The real power comes from how you stimulate it. But here's what most people don't realize. It's not just about finding the right spot. It's about how you approach it, because your nervous system responds to safety and rhythm far more than force. When men first hear about massaging this area, some assume they need to press hard or be aggressive, but that actually does the opposite of what we want. Remember, this region is filled with delicate nerves and blood vessels. The goal is to invite them to wake up, not to shock them into submission. That's why a gentle, mindful approach creates the most powerful results. I teach my patients a simple 1-minute ritual. You can do it lying on your back in bed, sitting comfortably, or even standing in the shower. First, place 2 or 3 fingers on the soft area between your testicles and anus. Apply light, steady pressure, just enough to feel the tissue beneath your skin. Then slow your breathing. Inhale deeply through your nose for 4 seconds, letting your belly expand. Exhale slowly through your mouth for 6 seconds, allowing your body to soften. As you breathe, make small, slow circles with your fingers over that spot. Not fast, not rough, just steady and rhythmic like a calm heartbeat. What should you feel? For many men, the first sensation is warmth. That's blood flow increasing in the area. Some feel a gentle tingling or a subtle pulsing. Others notice a wave of relaxation spreading through the pelvis, sometimes even up into the lower abdomen or down into the penis. These are all signs that the nerves are responding and the blood vessels are opening. If you feel nothing at first, that's okay. Nerves that have Been quiet for years can take time to wake up. What matters is that you are creating the conditions for them to do so. This is where consistency becomes everything. 1 minute a day may not sound like much, but nerves and blood vessels respond to repeated signals. It's like reminding a sleepy muscle that it still has a job to do. When you do this daily, you are gently retraining your pelvic nervous system to relax, to allow blood flow, and to respond to stimulation. Over time, those tiny improvements add up. Men often tell me they start noticing stronger morning fullness, improved sensitivity, and a deeper sense of connection to their bodies within just a few weeks. Now, let me tell you what not to do, because this is just as important. Do not press so hard that it causes pain. Pain triggers the stress response, which tightens muscles and restricts blood flow. That is the opposite of what we want. Do not rush through it while distracted or tense. This is a moment of communication with your nervous system. Give it your attention and do not expect instant miracles after one session. This is about gentle, cumulative change, not a dramatic one-time event. To make this a true ritual, I suggest pairing it with something you already do every day. Perhaps right before you go to sleep when your body is already shifting into a relaxed state, or first thing in the morning to help stimulate circulation. How to massage it and wake up your pelvic nerves. As you massage, keep your breathing slow and deep. The breath tells your nervous system that you are safe. Safety is what allows the parasympathetic system, the part responsible for erections and arousal, to come online. Many men are surprised by how emotionally grounding this can feel. Touching this area with calm attention often releases stored tension, not just in the muscles, but in the mind. You may notice a sense of calm or even a subtle emotional release. That's normal. Your pelvis holds a lot of stress, and when it begins to let go, the whole body can feel lighter. And when men do this for just a few weeks, something else powerful begins to change. But here's what most people don't realize. When you start activating this small pelvic control point, you're not just helping erections. You're quietly resetting a whole chain reaction inside your nervous system and hormones that touches nearly every part of how you feel as a man. This gentle stimulation sends a powerful message to the parasympathetic nervous system, the part of your body responsible for rest, repair, and arousal. When that system turns on, stress hormones begin to fall, muscles soften, and blood flow improves not just in the pelvis, but throughout the body. This is why many men report feeling calmer and more grounded after they begin this simple practice. One of the first physical changes I often see is improved prostate drainage. Over time, sitting, tension, and poor circulation can cause fluid to stagnate around the prostate, leading to pressure, discomfort, and irritation that subtly interferes with sexual function. Gentle stimulation of the perineum helps encourage that area to drain and circulate. Again, think of it like gently squeezing a sponge so fresh blood can move in and old fluid can move out. When the prostate is less congested, nerves can communicate more clearly and sensitivity often returns. Now let's talk about sleep, because this is where everything connects. Deep restorative sleep is when your body produces most of its testosterone. If your nervous system is stuck in stress mode, you may fall asleep, but you don't drop into the deep stages where hormone repair happens. By calming the pelvic nerves and activating the parasympathetic system, this simple massage helps your body feel safe enough to truly rest. Men often tell me they start sleeping more deeply, waking up fewer times at night, and feeling more refreshed in the morning. And when sleep improves, testosterone rhythm improves. You may not see a dramatic change on a blood test right away, but you will feel it. More energy, better mood, stronger morning erections, that familiar sense of vitality that you thought was gone begins to quietly return. Morning strength is one of the best signs that your nervous system and blood flow are coming back into balance. It means your body is responding to natural hormone signals again the way it was designed to. This is why I recommend either a nighttime or morning routine, depending on your life. At night, this practice helps you unwind, improve sleep, and support overnight hormone production. In the morning, it can stimulate circulation and help remind your body how to respond to arousal. Some men do both, but even once a day can make a meaningful difference if you stay consistent. I also encourage you to track what you notice. Not in a complicated way, just simple awareness. Are you sleeping better? Do you wake up feeling more rested? Are you noticing more warmth or fullness in the morning? These are signs that the internal systems that support potency are waking back up. The changes are often subtle at first, but they build week by week as your nervous system learns to trust and respond again. But if you've struggled for years, there's something even more important you need to hear. But here's what most people don't realize. The most powerful part of healing at this stage of life isn't found in a pill or a procedure. It's found in the quiet decision to stop giving up on yourself. I've sat across from so many men who believed they were too old, too far gone, or too broken to feel like themselves again. And every time I see the same thing beneath the surface, a body that still wants to heal, a nervous system that still remembers how to work, a man who still deserves to feel strong, desired, and whole. You are not broken. You have simply been living in a world that never taught you how to care for this part of yourself. For decades, men were told to stay quiet, to push through, to accept decline as the price of aging. If something went wrong, you were handed a prescription and sent on your way, often with a sense of embarrassment that made you feel small. Sleep and testosterone. That kind of experience chips away at your dignity. It makes you doubt your masculinity. It makes you feel alone in something that millions of men are silently going through. But healing isn't just about getting an erection back. It's about reclaiming a sense of control over your own body. It's about waking up and feeling present in yourself again. When you take 1 minute a day to connect with your pelvic nerves, to breathe deeply, and to give your body the signal that it is safe to function, you are doing something much bigger than a physical exercise. You are telling yourself that you still matter, that your comfort, your pleasure, and your vitality are worth protecting. Small daily actions have a way of restoring confidence. Each time you notice a little more warmth, a little more sensation, a little more morning energy, a quiet belief begins to return. You start to trust your body again. And that trust is deeply masculine. It's the foundation of presence, connection, and self-respect. I want you to remember that there is no expiration date on feeling alive. Your nervous system doesn't know how old you are. It only knows what signals it is receiving. Give it calm. Give it consistency. And it will respond in ways that may surprise you. And that's why this channel exists. But here's what most people don't realize. The simple spot we talked about today really is the missing link so many men have been searching for. And when you approach it with patience, consistency, and calm breathing, it can quietly restore what age and stress tried to take away. I'm grateful you spent this time with me because just by being here, you've already taken a step toward understanding your body instead of fearing it. That awareness alone changes how you move through your life. Everything we covered today comes down to one truth. Your body still knows how to heal. When you give it the right signals, it responds. And when you understand how your nerves, blood flow, and sleep work together, you stop feeling helpless and start feeling in control again. That's the kind of knowledge every man deserves. This channel isn't just about information. It's about building a community of men who are done staying silent and ready to take their health back together. If you found this valuable, join our community and subscribe so you never miss future guidance designed for men like you. Leave a comment, share where you're watching from, and know that you're not alone in this. You deserve confidence, energy, and deep restorative sleep. You deserve to wake up feeling strong in your body and clear in your mind.